I'm Chris Bullers. I'm the newest physician to join with AppOrtho. I'm a little different role than some of the other physicians there. I'm not a surgeon. I'm a primary care sports medicine physician. A lot of people aren't very familiar with this, but essentially my training is that I did a regular family medicine residency, so kind of a normal doctor, and then I did a second fellowship in sports medicine to where it's basically non-operative sports medicine and orthopedics. And so I still treat any injuries, anything else that comes in, but hopefully I'm not calling in my partner to see you if after our evaluation. But treat any fractures, any other soft tissue injuries, and hopefully we keep you from needing anything further. But if that's what the diagnosis is, then I get one of either Dr. Parker or Dr. Califf or Dr. Anderson. We have a great group of surgeons and get them in to make sure we take care of you. But hopefully I can treat you and keep you from seeing any of them. That's always my goal. The second big thing, and one of the big reasons I came up here, is that I specialize in concussion management. And to my knowledge up here, there's not anybody that really did that very much. I may be wrong, I hope I'm not offending anybody if I didn't know, but I did not really hear about too much of that. And that is a special subset of my training as a non-operative sports medicine doctor. And I actually did my training at the University of Pittsburgh Medical Center, which has one of the biggest concussion centers in the country. And so I did a lot of training up there. I also work with Wake Forest, which does a lot of studies in this. And actually, I was working for Wake Forest for the past 4 years before joining the group up here. And I was actually one of the principal investigators in the NCAA Department of Defense concussion study that's nationwide that involved both Wake Forest, Winston-Salem State, and 30 other schools across the country. So I saw this as an opportunity and a need up here and to join a good group and to come up and really provide. And so it's it's becoming more and more common to see concussion specialists in orthopedic offices, but a lot of people wouldn't say, oh, orthopedic office, let me call them if I'm worried about a concussion or anything like that. And so word's been slowly trickling out. I've only been here a few months, but I wanted to make sure I got out. I'm trying to get out more and more and make sure people know that I'm here, where I'm at, so if you need to see me, and also what I do otherwise, because sometimes it's a little confusing to people. They're used to seeing, if they're seeing a sports medicine doctor, they're used to seeing a surgeon. So it's every now and then I get these funny looks if they come in, they're like, wait a minute, you're not a surgeon? And so try to get that understanding out a little bit more. That's all I really wanted to say, just a few minutes about myself. And I'll let Dr. Parker talk a little bit, and then I think we'll let you get on with the rest of your meeting, okay?
Thank you.
All right. Thank you for having me.
Hi everybody, I'm Dr. Parker. I think I know a few people in the room already, unfortunately. We just wanted to come in. First of all, Jody, where you're in the corner there, I want to thank him personally because I think he kind of like started in his new job position when I first got here 8 or 7 months ago, and he was very welcoming for my family, and my daughter plays soccer and she had a good time with it, so we're excited to be here. And honestly, just knowing some of the people in the room, and as you're in this area longer, it's such a small community, and I'm happy to be a part of it. So thank you guys. I wanted to kind of reiterate what Chris said, and that I want you guys to know who I am and what I do, because we're trying to create an orthopedic group up here that is accessible to our community, so that our community feels safe and that they're getting quality care on the mountain, so it's easy for them. And fortunately, the hospital has done a great job of building that and hiring guys with subspecialty and bringing us up here. I've always divided my practice into being available, having the ability, and then being affable. And I think everyone in our group now has those components. They're all very skilled surgeons or physicians, diagnosticians. They all are people that I would trust to do surgery on myself, and they're also likable people, and we really take pride in that. I personally, I came from a little bit east of here. I grew up in Chapel Hill, went to Duke University, went to UNC for all my orthopedics training, and then went to Wake Forest for sports medicine, and then just moved here, and now I'm in the Appalachian area. So what I do primarily is sports injuries and shoulder and elbow surgery. So I do shoulder elbow replacement. That's what I like to do that's outside of the sports world. And then I do nothing but sports injuries. And that ranges anywhere from stress fracture management like Chris does, up to doing big multi-ligament knee reconstructions. I also do pediatric surgeries, and unfortunately in this day and age we see a lot more of those injuries now, just because of the way the culture is with subspecialization in sports. I'm taking kind of that niche and hoping to bring it up into this area so that we have someone to help take care of our community. And the other thing, so in the spirit of being available, I've tried to make it so that everyone at High Country Soccer, everyone at Watauga High School, and everyone at App State have a direct pipeline to us. So if someone's hurt on the field and we're not there, oftentimes this year, honestly, I was there because I was with my daughter. But if we're not there, please reach out to us immediately. Have Jody text me. He'll text me, and I'll fit you in at the next available appointment. The other thing that's important to know is that Jillian Barney, who's our PA, she's awesome. She works directly with me in the OR and in clinic. She is running a Saturday clinic now, and that's going to be going from like 9 to 12. So if someone's injured on the weekend, if there's any question about it, if it's really severe, please let me know, either through Jody or someone on the soccer field. If it's something that you guys are thinking, oh, let's go to urgent care or something, and it's musculoskeletal, come see the orthopedic services, because we have the x-rays, we have the diagnostics. She has a way to get in touch with us if it's something that needs an intervention. If it's something mild and she has a question, she can always ask us. And she's perfectly capable of kind of diagnosing and treating things on her own most of the time. So we want to be here for the community. That's why we've kind of partnered up with you guys, and I'm happy to be here myself. And if you guys have any other questions, feel free to ask and reach out to us. All right.